This is QD Clinic. QD Clinic is brought to you by Room Now Live, March 2021 in Fort Worth and virtually streaming. Today's case is clinic emergencies. Came to clinic this morning, a usual day, looking forward to the usual things that I do, but I walk in and there's mayhem. People running around, everyone looks distressed. There's a patient who's sick in room 3. What's going on? The patient's unstable. They're taking vital signs. This is not rheumatology clinic. This looks like the ER at the county hospital. So what do you do? How do you handle this? What's your plan? Obviously, they want you to take over, and you're not going to panic because you've got a plan. Number one, what's wrong? In this case, this is a patient who I don't know very well, who I haven't seen very much. Comes in, and I quickly surmise by talking to him and to his wife that the problems are asthma, not doing good, new diagnosis of atrial fibrillation, never had that before, not taking previous medicines for arthritis. There seems to be a new intercurrent problem. So again, your goal in these emergencies and urgencies is number one, to figure out what the problem is, and then in doing so, the clearer it is, the clearer you're going to know whether this is your problem, the primary care's problem, or a problem for a specialist or the emergency room. When it's not clear as to what the problem is and the patient is sick, you're going to default to C, send the patient to the emergency room. So the question then becomes, when you're not there, how would this have been managed? Everyone's looking to you to manage these situations. You have to go over this with your staff. You have to have sort of, fake drills to know how, mock drills to know how to manage this. They need to know, of course, what they were doing when I got there. They were taking vital signs, they were getting a blood sugar, they were doing a pulse ox, so that when I got there, or when they called me, they could tell me the vitals, the details that I was going to need. If you're not there, your staff needs to know whether this is a decision to either call 911, send the patient to the emergency room on their own, or send the patient to their primary care. If they don't know, the sicker the patient, the more the reflex answer is dial 911, let the ambulance and the hospital manage the situation. Again, they need specific guidance on what to do with chest pain, shortness of breath, diaphoresis with nausea and vomiting. That's always a bad sign. Fainting and hypotension. These are the things that are really going to need a drill, a plan, and your guidance. Again, I think that the real issue here is figuring out whether the situation is urgent, requires attention today or tomorrow, or emergent and really needs to go to the hospital. I wrote about this back in April. I wrote a blog called Urgent or Not, and then I wrote it about it because the issue was, who do we need to see during COVID? And that was the answer. If it's urgent, you need to see them, and urgent means face-to-face. Emergent either needs you in the hospital or the patient going to the hospital. So these were the guidelines I came up with for reasons that require your intervention, your patients being brought in if they're calling with these presumed complaints. Acute arthritis, because it could be septic, it could be gout. New trauma with pain and swelling, new suspected fracture. A new early onset inflammatory arthritis, inflammatory over the phone. How do you know? Hot, red, warm, swollen. They're going to meet all those criteria over the phone. Sudden worsening of polyarthritis in someone previously very stable. And that sudden worsening should have either swelling or functional implications to merit an urgent visit. Because most flares are usually not, they're new and they're bothersome, but they're not usually with swelling, not usually with a major functional implication. Fever greater than 102, bloody diarrhea, distal limb ischemia, where the limb, finger, toe is turning all kinds of colors, and that's a new thing. New focal neurologic manifestations, suspected cauda equina or spinal stenosis, that's new, especially if it has trauma involved, recent trauma. Suspected transverse myelopathy, acute onset of eye pain and blurred vision with redness. That could be uveitis, acute uveitis, especially so in SPA patients. Patients with hemoptysis, you worry about acute alveolar hemorrhage. and acute pneumonitis, shortness of breath, fevers, etc. What are emergencies? Well, there's a few that we need to know about, and they tend to happen in specific disorders. So, RA with stridor, and that could be cricoretinoid arthritis or subglottic stenosis in someone with relapsing polychondritis. Seizures in any of your patients is never a good sign, especially lupus patients with seizures. That's always worrisome. Other things in lupus that make me want to see the patient in the hospital would be altered mental status, very high fevers, coughing up blood, suspected pericarditis. Ankylosing spondylitis with a trauma, spinal trauma or major fall. These need to be imaged right away and seen right away, probably best in the hospital. Inflammatory myositis with dysphagia, increasing dyspnea, or rhabdomyolysis. Again, that dysphagia and dyspnea, the upper pharyngeal involvement, usually has some really bad outcomes if not viewed as an acute emergency. A scleroderma patient with potential renal crisis, that would be hypertension, microangiopathic, hemolytic anemia, etc. Stills patients who you think may have macrophage activation syndrome, they need to be seen in the hospital. Thrombotic events in any of your patients, especially lupus patients, that could be a new sudden MI, CVA, DVT, or someone who has the catastrophic antiphospholipid syndrome. Again, the bottom line here is you need to prepare. You need to have drills. There needs to be a plan. Jobs have to be defined, and your staff needs to know who's going to do what, and how the decisions are going to be made with you there and with you not there. Room Now Live, it's in Fort Worth. Again, Room Now Live is the best original hybrid meeting that we have a live meeting that you can come to in Fort Worth, or you can attend online. Go to roomnow.live and find out more about our upcoming meeting in March. Tune in for more QD clinics.